Greetings and welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, and my co host today is Erica Neal, Roots Health Navigator, and we are reporting for the week of June 21st, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID 19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So, we're here to give you up to date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has 89,649 COVID cases and 1,277 COVID deaths. Vaccination rates continue to increase, and we are almost at 80% of those who are eligible, which is those 12 years and up, having received at least one dose, and a little over 66% having been fully vaccinated in the county of Alameda. The city of Oakland is not too far behind, with about 78% having received one dose and about 63% being fully vaccinated. We still do notice disparities with areas of East Oakland as well as the Ashland Cherryland area having only about a little over half of the residents who are eligible being fully vaccinated. And the city of Piedmont, a whopping 100% is reported to have received at least one dose of the COVID vaccine. With regards to cases, we are still low, but did want to point out a slight uptick that we're seeing in terms of the 7-day average of percentage positive tests is just starting to tick up there. You can see over to the right, as well as COVID 19 hospitalizations just starting to tick up a little bit on the right there. So, not sure yet if this is significant or will continue in this direction, although, certainly, with the dropping of COVID related restrictions on June 15th, we do expect to see increases in cases. And typically, when there's increases in cases, we also see increases in hospitalization. Although, now with the vaccines having entered the picture, we can certainly be hopeful that this will not be the case. But because we're also dealing with more contagious and more virulent, more dangerous strains of COVID 19, including the Delta variant, which we know is right here in the Bay Area, we are keeping a close eye on this to see what unfolds. And of course, watching other parts of the world that have already been overtaken by the Delta variant, like the UK. Now, we've known from very early on that people with diabetes do worse than others when it comes to COVID 19. They are at higher risk of being hospitalized, at higher risk of dying. And if you'll recall, back when the vaccine first came out, that is why people with diabetes were prioritized to go to the front of the line when the vaccine first became available. But in addition to knowing that if someone has diabetes, they do worse with COVID, we also started seeing that people were developing diabetes from COVID. In fact, there are a number of studies that demonstrate the increased risk of new onset diabetes during either the first phase when you catch COVID or shortly after recovering from infection from COVID 19. So it's even been reported in those long COVID data. And so this has been established through a number of different studies. But all these studies were pointing out the correlation and still without a lot of information about why this was happening or what was going on. So, for that reason, there was a call across the globe to form a registry to better understand the magnitude of the problem. And so now we have a global registry of COVID 19 related diabetes that has been established by researchers from all over the world. And so we expect that we will continue to learn more as a result of that. But in this past November of 2020, the Journal of Diabetes, Obesity, and Metabolism published a global study. It was a meta analysis. So they basically searched the land for all the different published articles. And they did what's called a meta analysis, where they kind of put that data together from 8 different studies to the best that they can with matching what they can. And they found with over 3,700 patients who had been hospitalized with COVID, there was a pooled proportion of 14.4% of those people having newly diagnosed diabetes. And so that is a fairly significant percentage of people who did not have a diagnosis of diabetes beforehand. Now, is it possible they were pre diabetic or they were prone to diabetes? That was not established by the study. It's just that in over 3,700 hospitalized patients, 14.4% of them were diagnosed with new diabetes. They had never been diagnosed with it before. The article ends off by saying, and I quote, "We are now seeing a classic example of a lethal intersection between a communicable and a non communicable disease." And that was from Diabetes, Obesity, and Metabolism Journal. So that is a fairly sobering statement there. And it does appear that there is an intersection. And now we are learning more about what that intersection is about. So, the director of the National Institutes of Health actually recently put out a blog article that goes into this in some detail. You can see it here about the studies that have been going on around diabetes, and I'm going to go over those in just a moment. But first, some basics about diabetes. So, diabetes is actually a group of diseases. You've heard of type 1, type 2. There's also gestational diabetes, which can happen when a woman is pregnant. But basically, bottom line is all of these diseases of diabetes, they basically result in too much sugar in the blood. And too much sugar in the blood happens because there is either not enough insulin, which is the hormone that keeps the sugar at a normal level, or the insulin that's there isn't being properly used by the body. And so people with diabetes, they either don't make enough insulin or they don't properly use the insulin that they have. Insulin is made by beta cells, which are found in the pancreas. And that's that little orange organ here, which is situated right behind the stomach. And so, as I mentioned, there's been a lot of work to try to determine the association between diabetes and SARS-CoV-2, the virus that causes COVID-19. And we have studies actually from as long ago as June 2020, so a year ago, right around the beginning of the pandemic, that really set out to look for any connections because, as we knew from the very beginning, people with diabetes were doing worse. So we wanted to establish what the connection was. And that those studies actually established that SARS-CoV-2 does infect the beta cells in the pancreas, and it actually replicates inside of those cells. And remember, the beta cells are the ones that make the insulin. So the SARS-CoV-2 can get into those cells, it can replicate itself inside those cells, and it can go on to infect other cells. So we knew that the virus could get into the pancreas cells and replicate there, but we weren't really sure beyond that what was going on. But now we do know more. We have 2 recent studies that just came out in May, and they were looking at this issue and kind of building upon the information from the prior studies. And this is, of course, how scientific research works. And these recent studies were recently published in the journal Cell Metabolism. These studies discovered SARS-CoV-2 in the beta cells of the pancreas of people who had died of COVID-19. So these were more or less autopsy studies. They also found that beta cells infected by SARS-CoV-2 could either be killed or they could start acting differently. So the SARS-CoV-2 could replicate inside the cell, it could kill the beta cell. And for the cells that it doesn't kill, they start to act differently. They appear to be going through a process called transdifferentiation, which is like basically the cell getting kind of reprogrammed, where they actually produce less insulin and then they start producing more of a hormone glucagon as well as some enzymes that basically end up leading to more sugar in the blood. So, either way, through less insulin, more glucagon, or other enzymes, we are ending up with a diabetes situation here from COVID 19. And again, this could happen during the actual time when you're sick with the COVID 19 or during the recovery period or the period after getting over that acute part of SARS-CoV-2 infection. So, what does this mean? Well, we already knew that COVID was causing new onset diabetes, and now we understand at least some of the ways or the mechanisms for how this happens. And this is really important because hopefully one day this will help us to find a way to prevent this from happening or maybe even reversing it after it happens. But right now, we just have a whole lot of people with new onset diabetes from getting COVID. So it seems very clear now that diabetes and COVID are a two-way street. If you have diabetes, it can cause you to have a worse outcome if you catch COVID. And if you have COVID, it can actually cause a new onset of diabetes. And we know that diabetes has a number of potential effects, especially if it's not diagnosed or treated. And so we encourage everyone to make sure that you get checked for your sugar levels, or usually you will need to do a fasting sugar. If you have diabetes, please do all you can to manage it and to be seen by your primary care doctor to make sure that you are controlling your diabetes, and also don't get COVID. So we really want to avoid getting COVID. We have seen every week, it seems we're learning something new about what COVID can cause. We know that it can wreak havoc on almost every single organ in the body. And now we have a direct correlation, including the mechanism of how it happens, of this causing one of the most common chronic diseases that we deal with that causes blindness. It can lead to kidney failure, having to be on dialysis. It can lead to amputations. So, this is a pretty big deal, and we want you to be cautious and also to have this information so that you make sure that if you've had COVID before, you've been checked for diabetes. And if you've not had COVID before, you don't get COVID. And so that means taking all of the precautions, including the vaccination. And now, my co host, Erica Neal, Roots Health Navigator, will talk a bit about managing diabetes within the COVID pandemic. Erica?
Thank you, Dr. Noha. My name is Erica Neal, and I'm a diabetes and healthy brain health navigator at Roots South Bay. And I'm very excited to co host this episode and talk about managing diabetes within the pandemic. Presented to you are some important terms that we need to know in order to have an open conversation about managing prediabetes and diabetes. Now more than ever, it's important to stay on top of your blood sugar and A1C levels as we navigate this pandemic. Attending all of your appointments, even if they're virtual, is a great way to get back on track to continue your progress. Building a healthy meal is another great step to getting back on track with your management plan. Informing your providers about life changes and how COVID has impacted you or your loved ones can help to reduce stress. Never be afraid to reach out and discuss your progression with your provider in regards to your diabetes management. Remember, your provider is there to help you along the way and incorporate safe exercises and activities, as well as diets and foods that flex with you. COVID has emphasized the need to be physically distanced and quarantine if necessary, which for many can create a sense of isolation. Finding virtual support groups are a great way to fight the COVID blues, gain accountability partners, and reduce stress from your diabetes management journey. As the state begins to open up, be on the lookout for more information regarding our diabetes prevention and management program. Thank you.
Thank you for that, Erica. Now, here's our best advice one more time. COVID is still among us. We now have more contagious and more virulent strains among us. Please protect yourself and those around you through all of the layers of protection designed to keep you safe from this very tricky virus. Remember, there are three main ways you can contract COVID. Aerosol is the most concerning and most common way. And the way to prevent yourself from catching it through aerosol transmission is primarily through engaging in mostly outdoor activities. Avoid crowded indoor spaces. If you must be indoors, make sure that you have good ventilation and make sure that you are wearing a high filtration mask. The second way is droplet. And for that, you want to keep your physical distancing and you want to also wear a mask. And contact is the least common way of contracting COVID, but it is still a way. So make sure that you are washing your hands, not touching your face, sanitizing and disinfecting, especially your high touch surfaces, and wearing a mask also keeps you from touching your nose and mouth. So it is recommended for all the ways of potential transmission of COVID 19. If you get COVID 19 symptoms, and note that with these new variants, the symptoms are also changing. You're not necessarily going to lose your taste and smell. You may have just like a regular cold like symptoms, but it could still be COVID. So if you get symptoms, whether you are vaccinated or not, please get tested and isolate until you get your results. If you think you may have been exposed and you've not been vaccinated, isolate. Get tested in 4 to 8 days and isolate until you get your results. If you are eligible, get vaccinated. If you are still unsure if you are eligible or you have questions, please reach out to your primary care physician or send us your questions. We want to make sure everyone has all of the information that they need to make the best decision possible. Avoid crowded indoor spaces. Go see your primary care physician to get checked out for diabetes, hypertension, cholesterol. And if you have these conditions, that's okay. You can keep them under control, but you've got to make sure you know where you stand and you have the proper treatment in place. Exercise, get a good night's sleep, manage your stress, eat a balanced diet, take a multivitamin, and consider additional vitamin D supplementation. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.